get into another important conversation now. Unemployed doctors in KwaZulu-Natal say there should be no budget cuts for the healthcare system and that an additional budget must be sought to hire the over 800 doctors who are sitting at home right now without jobs. This is nationwide. The doctors marched today to the KZN Department of Health. This is to hand over their grievances. Let's get reaction now, and we're joined by Dr. Mvuyisi Mzukwa. He's from the South African Medical Association, the chairperson there. Dr. Mzukwa, thank you very much for your time. So 200 doctors marching today in KZN, and already there are flyers suggesting that tomorrow, this will be Tuesday, there will be doctors in the Eastern Cape who will join the picket line. Is this matter getting the desired attention, do you think?
Good evening to you, Polly, and to your viewers, and really thank you for inviting me to your program. Actually, the South African Medical Association supports the plight of unemployed doctors. And as you know, we are, doing work, we're hard at work, assisting wherever we can, to make sure that these doctors don't stay at home, because we know that, for example, there's been a recent report, I think recently, by the World Health Organization. You will recall that all of us are talking about universal health coverage, but in South Africa we call it NHI. So if you look at that, you notice that according to the WHO report, it says that the world is off track, with that significant with significant progress, towards this universal health coverage. In other words, we're steps away, far away from this Vision 2030, and we know that the World Health Organization has further suggested that to build back better, we need to reorientate our health systems, using the primary health care approach, because about 90% of the essential universal coverage interventions can be delivered through PHC, and we know that these doctors were going to assist a great deal in this regard, because we know that the delivery of these services would require healthcare workers, obviously, with optimal skills, obviously, at all levels, a skills mix, and also distributed equitably, urban areas versus rural areas. But also they must be adequately supported with access to quality assured products and enjoying a decent work. Now, in South Africa, there is a dire shortage of these doctors. Yeah. You will know that in South Africa, one doctor is looking after 3,000 patients or citizens, if I may put it so. So that is not what we think we should be doing as a country, when actually we are touting NHI, we're telling people that we're working towards the NHI. Hence, some are saying we think that the country is not ready to accommodate NHI, and hence we have as SAMA organized a conference from Thursday this week, where we're putting our minds together, from all stakeholders to say, how do we strengthen the healthcare system in South Africa?
Dr. Mzukwa, do you accept the argument that was put up by the Health Minister, Dr. Joe Phaahla, who said provinces are unable to create vacancies or posts for these doctors because medical officers' salaries are expensive or they are high by their very nature? But he hastened to say that they are working with provinces to make sure that these doctors are placed in the public health care sector. Do you accept that argument?
Let me dispute that with the contempt it deserves, because SAMA has done a study, that shows that public health doctors, in fact, are underpaid. They are getting a salary that they were supposed to get in 2015. So to come up and say that they are spending lots of money on salaries for doctors, South African doctors are underpaid. We have a study to show that. Secondly, they are only talking about overtime. South African doctors have to make up salaries because of overtime. If you take away that overtime, there is absolutely nothing. They are earning peanuts, but they are working hard. The work environment is not so decent. It's not decent, to be honest with you. And also there's security issues, and hence you see some of these colleagues leaving away because you've got broken machinery, you've got all these things. You cannot support healthcare workers. Even during the times of COVID, we had, a rhetoric from the minister saying that these are heroes and heroines. I mean, how do you become a hero when you are not supported? How do you become a hero when you suffer from mental illness because of the system that you are working in? So I don't believe that the minister was telling the truth to the nation. Actually, they are owing South African doctors. They should be paying them more.
Let's talk about his deputy, because he was the one, I think, that received the memorandum down in KZN. And he said words to the effect that this matter will be discussed and possibly dealt with during the Sona debate, which is going to begin tomorrow. Was that something that you take seriously, that a matter as difficult as this one can possibly be dealt with in a Sona debate?
Well, they become emotional when they tell them that they are telling the public, nothing. You'll recall that the minister was on air, called the media houses and had a media briefing. And I was expecting the minister to tell the South Africans that there's a plan in place. They've already spoken to provinces. They are creating those posts, but also they've already approached Treasury. And this is the response from Treasury. But no, the response was that we are still going to talk to the provinces. We are still going to approach Treasury. And the same thing, I mean, what is a debate? You can't be promising talks out of a debate of a Sona. I don't think that was a very intelligent response from the minister to the deputy minister. It shows how they are just not in touch with what is happening on the ground. Because if you look on the ground, things are dire. You look at litigations; they are sitting at 120 billion and still counting. And it's because there's shortages, there's broken machinery, the system is in a crisis. But they will not agree to that because they think that we are an opposition party when we tell them the truth, that our communities on the ground are suffering. The stories that are out there in the media that shows that we are not giving the necessary quality services that our communities deserve.
Final question to you, Dr. Mzukwa. This is something that I think was observed by the Health Minister himself when he was, I think, responding to questions from journalists, where he made a statement that says this is actually a paradox. It's a contradiction in terms, because the health department in just one province was faced with medical negligence claims amounting to some 900 million rand. And he says that that amount of money could actually be used to pay the doctors, the very people who can help prevent these medical negligent claims. Is this something that you think they are now alive to, that these doctors must be absorbed because they are going to help reduce these medical negligence claims? But someone else could actually come back and say, but in the very same public health institutions where there are these claims, surely those are doctors who qualified in the very same institutions that the doctors who are unemployed right now came from. Did you get my argument here?
Look, it is indeed our plea to the minister to say you must employ these doctors so that we avoid the unnecessary litigations that we see in the state. But what we see and what we've heard from the minister is contrary to what they are telling us now, because they were telling the public through the media briefing that those doctors should go to the private sector and seek employment. Even suggested that those doctors can go abroad and then come back. Now the thing is, we don't agree with that logic to say, as South Africa, we are in a dire shortage of healthcare workers, but we're suggesting that our doctors must go abroad. Or our doctors, I mean, you've had these emotional rhetorics from politicians who are saying the resources in health are in the private sector. But they themselves are telling these doctors to go in the private sector. They've been telling us that in the private sector is serving about 15% of the population, and the private sector about 85%. Now, how do you then take resources, the very same resources, that actually were paid for by taxpayers, because doctors, when they train, they use taxpayers' money. So you would expect that, there is a forward-looking in terms of the planning. So it tells me that, we've got people who are sitting there who have a plan called a health workers resources, human resource for health 2030 strategy. But that strategy is sitting there, and not doing anything. We've got a plan in place, but you are not implementing the plan. So that debate that they are talking about today, I don't honestly believe that is going to sort out this problem. The problem is we must ask and in fact insist that Treasury must bail out the Department of Health. If they can bail out entities that are not really assisting the country like SAA, why can't they save sick human beings in the Department of Health and assist the Department of Health to come out of this problem? So we are insisting even today to say, they come to their senses and employ all those doctors? Because in the public sector now, we've got about 1,500 unfunded posts. That's what we've been told. But no, they are still thinking about that. But on top of that, Polly, that some money in some provinces have been taken back. There was under expenditure by the same Department of Health.
Absolutely spot on. Dr. Mzukwa, let me thank you very much for your time. Very, very strong arguments from the South African Medical Association.